You might have been recommended a course of Cognitive Behavioural Therapy, or CBT, and perhaps you're wondering what it is and what it involves. If so, you're in the right place. I'm Dr. O'Donovan, and in this video, I'll explain what CBT is, what it's used for, and what it involves. But before we start this video, I want to say that while this is an educational resource only, if you are here and you're experiencing a mental health crisis or emergency, help is available no matter what you're going through. And I've included links to support organisations in the UK and the US in the description box of this video. And please always reach out to your own doctor if you need to. So what is CBT? Well, Cognitive Behavioural Therapy, or CBT, is a type of talking therapy where a therapist helps you to change how you think and act. It can treat many different mental health problems and is incredibly effective for certain people. Now, CBT is based around several core principles, including that psychological issues are partly based on problematic or unhelpful patterns of thinking. Psychological issues are partly based on learned patterns of unhelpful behaviour. Thirdly, that psychological issues are partly based on problematic core beliefs around central ideas about yourself and the world. And finally, that individuals experiencing these issues can learn better ways of coping with them. Now, this can help relieve symptoms and improve mental as well as emotional health. So which mental health problems can CBT potentially be helpful for? Well, CBT is recommended as a treatment for many mental health problems, including depression and postnatal depression, anxiety, including social anxiety, phobias, and obsessive compulsive disorder, also known as OCD, post-traumatic stress disorder, also known as PTSD, eating disorders, including anorexia and bulimia, bipolar disorder, and personality disorders, so a whole host of problems. Now, CBT can also help with other conditions, including sleep problems like insomnia, problems with alcohol and drugs, long-term pain, irritable bowel syndrome, as well as chronic fatigue syndrome. So now we know what it is and what conditions it can be helpful for, or what happens before starting a session of CBT. Well, once you've been referred for CBT, you'll have an assessment with a therapist to decide what the best treatment is for you. Now, this may be done in person, online, or over the phone. Now, the therapist will ask about your symptoms and what you hope to get from the treatment. They'll then recommend a type of therapy, which may be CBT or potentially another type of therapy, depending on what you need it for. They'll also usually tell you how long you may need to wait until you get treatment. Now, while you're waiting for treatment, you might want to try self-help for mental health or self-help CBT techniques on the Every Mind Matters website, which I've included links to in the description box of this video to help you. So now we've covered what happens in the workup before you might have a series of CBT sessions, let's cover what happens in CBT. Well, there are many different types of cognitive behavioural therapy. The type that you will have will depend on why you're having it as well as your symptoms. Now, you can have CBT in a range of different ways, including guided self-help, which could mean going through a workbook or an online course with the help of a therapist. It could be one-to-one sessions with a therapist, or it could be as part of a group with a therapist and other people who are dealing with a similar issue. It's important to find the particular type and style that works best for you, because everybody is different. Now, CBT can be done in person, online, virtually, or over the phone. Now, you'll usually have between 5 and 15 sessions of CBT, depending on what you're having it for. Now, in CBT, the main aim is making changes to solve your problems. In a typical session, you'll talk about the situations that you find difficult and discuss how they make you think, feel, as well as act. You'll work with your therapist to find out different ways of approaching these situations. Now, this could include questioning unhelpful thoughts and beliefs and considering other ways of looking at things. It could be about noticing your emotions and physical feelings without reacting to them, or changing what you do. So, for example, doing activities that you actually have been avoiding in the past. Now, your therapist will help you to find approaches that work for you and the problems that you're having. You'll usually be asked to practice what you've learned between sessions, and it's important to do this for CBT to work. Now, each therapist is different, but you might be asked to record your progress in a worksheet or diary so that you can go back over this to reflect on it. So what happens after you've had CBT? Well, after your course of CBT has finished, it's really important to keep using the skills that you've learned. Your therapist will usually help you plan how to do this. Now, if your symptoms don't improve after your first course of CBT, which might be 5, 10 or 15 sessions long, you may be given more sessions. You should speak to your doctor, however, if you're still having problems after your CBT has finished. They may suggest having more CBT or a different type of treatment. And CBT can be really effective when combined with other forms of treatment such as medication. Now, for more information on CBT, including how to access it in the UK, please see the description box of this video. And if you want to share your experiences with CBT to help others, please do so in the comments section. Thanks for watching and bye.